Hi, everyone, and a warm welcome to another episode of the Talk Room series of podcasts. And in this episode, we examine the question of how to be your best self. And we do that by examining mental health in well-being and how this applies to people's daily lives. For those people who have yet to see any of our previous podcasts, I'd like to introduce my presenter, Wendy. Wendy is a highly experienced CBT psychotherapist in private practice and has been involved in the field of mental health and well-being for well over 30 years.
Thank you very much, Ian, for that introduction. And now to introduce you. Ian, you are a senior accredited National Counselling and Psychotherapy Society member and the founder of Hope Therapy and Counselling Services. A warm welcome.
Thank you, Wendy. So today we're going to be looking at the fascinating subject of health anxiety. So Wendy, I wonder if you can just start by telling us what exactly do we mean when we say health anxiety?
Yes, certainly, Ian. So, health anxiety is also known as hypochondria or sometimes called illness anxiety disorder. And it is a condition where people have an excessive preoccupation with the idea that they're seriously ill. This preoccupation persists despite tons of medical reassurance and even a lack of significant symptoms. So, what happens is people with health anxiety often interpret normal bodily sensations or minor symptoms as signs of severe illness. So, for example, a pain in the stomach would be misinterpreted as stomach cancer. And obviously, this anxiety can feel very overwhelming and continuous, making it difficult to concentrate on day to day activities. But health anxiety is more than just worrying about a person's health. It can create an intense, irrational fear that can really overwhelm a person. If a person is suffering from health anxiety, they may spend hours researching diseases on Dr. Google, trying to get reassurance from various medical doctors and practitioners, and frequently and obsessively checking their bodies for signs and symptoms of illness. So the overall condition can lead to people feeling very distressed, and it can really impact on a person's social, work, and personal areas in their lives.
Really interesting. So thank you
Mm.
for that, Wendy. Um, so with all of that in mind, how is health anxiety or hypochondria, how does that develop in the first place?
Okay, very good question. Thank you for that, Ian. So, there can be a combination of factors that can lead to this condition. Um, so, um, the first one can be personal or family history. So, maybe if someone has experienced a serious illness in the past, they might have become more vigilant about their health. So, for example, if a person has recovered from cancer, they may be more sensitive to noticing any changes in their body because they obviously fear a relapse. Or it's possible if a family member has suffered a serious illness. This also can heighten a person's awareness and anxiety about their own health. Another combination of factors could be traumatic experiences. So these could be traumatic health related traumas, such as severe illness or injury, can trigger health anxiety. For example, if someone has survived a serious car accident, they may become overly anxious about their physical health and potential injuries in the future, as that's one example.
Hmm.
We're all exposed to so much information on the media. So, information about diseases, in the media or online can also lead us to all have health anxiety. We're very much aware of the pandemic that's happened recently. So news stories about outbreaks of diseases or health scares naturally and understandably make people more fearful about their own health. And with social media, as you're aware, there's a constant stream of information and personal stories about people's health issues. So this can all contribute to anxiety. Another factor is personality traits. So research suggests that some people are more naturally prone to anxiety and worry than others. People who maybe tend to be more perfectionists, or those who feel the need to be in control, those kind of characteristics might make people more susceptible to health anxiety. These personality traits can make people more vigilant and worried about potential health problems. So that's another factor. How we think. How we think about our health can influence the development of health anxiety. So people who have more of a tendency to catastrophize or imagine the worst possible outcomes, so like a cough, they would make them fear that they have a serious illness. So it's the way we appraise our symptoms. And another one is it's called medical student syndrome. And what happens is it's where students who are studying medicine or other health related subjects, because they're thinking about it all day long, they can often start to worry excessively about having the diseases they're learning about. They learn so much about the different illnesses, it's in their heads a lot, so they are more likely to believe that they have those conditions as well.
That's fascinating, Wendy. So thank you for that. And I wonder if you can just say a little bit about the sorts of problems that are caused by people that have health anxiety.
Yes, I think as I said earlier, health anxiety can lead to a range of difficulties that can affect a person's individual life. So examples can be having very difficult emotions, affecting our understanding of our physical symptoms, our relationship with our body, or even social events. So I've just got a couple of things which I think might be useful for people to know. So one problem is that people with health anxiety, they often are in a constant state of worry about their health. The worry is all the time, making it very difficult to concentrate on other activities such as work or schoolwork, hobbies, or even spending time with their friends and family. And also, this constant worrying or constant anxiety can really lead to feelings of helplessness and depression. Another aspect that happens is you get frequent doctor visits. So if a person is suffering from health anxiety, they're far more likely to visit doctors or other healthcare professionals more frequently because they seek reassurance about their health. And the problem is, even when the medical tests show that they are healthy, they haven't got any illnesses or diseases or anything like that, this reassurance often doesn't last very long. They then start to worry again, and they may feel the need to see either the same doctor or even another doctor for a second opinion and then request further tests. So this constant cycle of looking at and checking symptoms, going to the doctor, seeking reassurance and going back, this cycle can be so exhausting and take up considerable time with themselves and also the healthcare system. And the other problem is healthcare professionals may also start to dismiss the person's real symptoms, assuming that it's just another health anxiety scare, or can become exasperated by the constant request for reassurance and then can become irritable or impatient with the person themselves. So another problem is to cope with their anxiety, people might start to avoid places or activities that they believe could make them sick. So, for example, they might avoid hospitals, public transportation, or crowded places. So this avoidance can lead to secondary problems like not going to hospital visits, but also can limit their activities and reduce their quality of life. So this also can lead to more social isolation as they avoid social gatherings or events of fear of getting ill. And then physical symptoms can be a problem. So anxiety itself causes real physical symptoms. Classic examples could be headaches, stomach aches, tension of muscles, or racing heart. So these anxiety symptoms can be very confusing and distressing for the person. So the symptoms of anxiety can also lead them to believe there's something wrong with their health. This creates another vicious cycle where the anxiety causes the physical symptoms, which then increases the anxiety, causing more physical symptoms. So another vicious circle there. The other problem is that health anxiety can cause strain in relationships with family and friends. So loved ones might not understand why the person is so worried about their health all the time, especially when the doctors say they're fine. So this can obviously lead to more frustration and misunderstandings. The person with health anxiety often can seek reassurance not from medical practitioners, but also from loved ones, which can cause conflicts and frustration within the relationships. And then overall, health anxiety can have a significant impact on the person's quality of life. So therefore, the worry, the frequent doctor visits, avoidance behaviours, seeking reassurance prevent the person from really getting the most out of enjoying life and achieving their goals. It can also affect their performance at school or work and their ability to engage in meaningful activities. So it affects them ever such a lot in many different ways.
Fascinating, I can see that it's really, really impactful for somebody struggling with health anxiety. Um, so we have this really impactful condition. What do we do about it? What sort of treatments are out there for people struggling in that way?
Yeah, thank you, Ian. A very good question again. So, the good news is there are lots of evidence based treatments for health anxiety, where they can get help to better manage their anxiety and improve their quality of life. So, I'm just going to give some brief outlines of some treatments. So, the one which is most well known is cognitive behavioral therapy, or CBT for short. And this can really help people to understand their thought patterns and behaviors that contribute to this anxiety or this vicious circle we were talking about earlier. So, one particular aspect in CBT is identifying the negative thoughts. So, actually being more aware of and identifying the negative thoughts are the first stage. Understanding that these thoughts are often irrational and exaggerated. So, classic example is what I said before. Someone might think if they've got health anxiety, they think they have a headache, so therefore they catastrophize and think, that means I've got a brain tumor. So the therapist can help the person recognize that the thoughts are there in the first place, they're unhelpful and are contributing to their anxiety. Then the next step is actually learning how to challenge the negative thoughts. So this can be done by the therapist asking questions. Say, so what is the evidence that your headache means you have a brain tumor? Is there any evidence at all? Is there any evidence that you haven't got a brain tumor? What other possibilities might there be? So really challenging these anxiety-provoking thoughts, the person then learns to develop more realistic or balanced thoughts. And then behavioral changes is also very important in CBT. Changing behaviors that maintain the anxiety. For example, the person might avoid activities out of fear of becoming ill. So the therapist might help them to gradually face these fears using a process called graded exposure. So gradually the person, step by step, introduces new behaviors into their life. They start going to hospital, they start going to nice places, concerts, places they want to go in a controlled way, and therefore they learn how to manage their anxiety. Another aspect is coping skills. So these are skills such as relaxation techniques, deep breathing, progressive muscle relaxation. Another one that I'm very fond of is problem solving techniques to address specific problems. So getting very, very good at problem solving, coming up with lots and lots of ideas, generating ideas, and actually looking at a plan to how to solve the problem. The other area is popular is mindfulness now. And this really helps the person to stay present and focused on the current moment rather than over worrying about their symptoms. Another element with CBT is the ability to build resilience. This means helping them to deal better with problems such as uncertainty and stress. The person learns to tolerate uncertainty about their symptoms and accept that it is possible. You don't have to be completely certain about their health status at all times. So understanding a little bit more about tolerating uncertainty and ambiguity. And another therapy, which I'm very fond of, is called ACT, which stands for Acceptance and Commitment Therapy. So they have slightly different focuses in this therapy, but I think it'd be really useful to explain a little bit more how it can help health anxiety. So ACT focuses on accepting thoughts and feelings rather than fighting them, and committing to actions that align with the person's value. So for one example would be just encouraging people to accept that we all have anxious thoughts and feelings. It's part of a normal life. So instead of trying to eliminate all the anxiety, which can be very, very difficult and counterproductive, ACT teaches people to acknowledge their anxiety is there and simply just to make room for it. And this helps people to reduce the struggle they have with anxiety and actually focus more on things that they can control. Another important aspect of ACT is commitment. So this is about helping people to commit to actions that are in line with what is important to them, i.e., their values. So, for example, if someone values spending time with their friends, but because of their health anxiety, they're avoiding being out with their friends, social situations for fear of getting sick, that helps them to commit to socializing in spite of their anxiety. And so how this helps this person is they actually lead a more fulfilling and meaningful life, and they've got less time to think about or worry about their symptoms because they're out there enjoying their life, living their full life, and committing to that life. Another really good technique in ACT is called diffusion. And this is the way we encourage people to relate differently to their thoughts. So rather than seeing that their thoughts as absolutely truths, they just learn to have a different relationship with their thoughts. They learn to say it's actually just a thought and not necessarily a fact, and use techniques to actually help develop that further. And as I said earlier, ACT is very good at clarifying what is important to that individual, what gives them meaning. And by actually focusing meaning, following their own values, this helps motivation and direction to make positive changes. So they feel more empowered, they can make decisions that matter most to them rather than their life being driven by avoidance and anxiety. And another really key goal of ACT is to increase psychological flexibility. So what that means is actually by actually living a more meaningful and fulfilled life, and going out there and enjoying themselves, they actually learn the skills to respond to situations as well. So they learn how to control or navigate their anxiety, and this leads to a richer, more meaningful life. The other therapy I'm very keen on is called compassion focused therapy, or CFT for short. And there's key components in this therapy which I think are very, very helpful to understand health anxiety. And the main thing about compassion focused therapy, it's about developing a more kinder, compassionate relationship with themselves. this can be really helpful for people with health anxiety because they're often very, very self-critical. So this is about developing self-compassion skills. And this could involve treating themselves with the same kindness and understanding they would offer to a friend. So being more aware and kind and understanding their suffering, accepting that suffering is a common human experience and that we need to respond to ourselves with kindness rather than the negative self-criticism. CFT really helps us to understand our emotions and where they came from. It can be helpful to explore past experiences that have contributed to their anxiety and to understand and be kinder that there's a reason why we develop these anxiety feelings and behaviours, to actually be more compassionate towards the roots of actually the causes of health anxiety. So that actually can really help people. It's also about developing skills, a bit like CBT, so calming skills, self-soothing skills, being more compassionate to yourself is very key to compassion-focused therapy. And it does this by actually saying we have 3 emotional regulation systems. So the first one is called the threat system. This detects danger and triggers anxiety. The second one is called the drive system, and this is used to motivate us and achieve our goals. And the third one is called the soothing system, which helps us to feel more safe and calm. So the idea is the more you develop the soothing system through self-compassion activities, you can therefore reduce the dominance of the threat system, which creates the anxiety, and therefore you can create better control of your anxiety. And the other benefit of this is actually doing nice things like self-soothing things, self-compassion. They're nice things to do. So it's a really lovely therapy for people to use. Compassion-focused therapy also uses imagery techniques to help develop these compassion skills. An example of this can be developing a warm, kind, compassionate person in your mind who's there to provide support, encouragement, and wisdom to learn. If the person's not very good at being compassionate to themselves, if they see an imaginary compassionate person being compassionate towards them, that can actually really help to internalize this idea of compassion. And also, compassion is seen as a strength. It's seen as a way of building resilience, and therefore it's about facing fears and challenges, but not with a kind of strict critical way, with a sense of kindness and support rather than being critical. And the last one I just want to mention is EMDR. And this is really, really good because it can actually help people if the reason why they got health anxiety is they've had a past traumatic experience about their health. It's actually very, very good to process past memories of that trauma. And this is done by the therapist guiding the individual to use their eyes and move their eyes in a certain way. And this is a way of actually processing the actual trauma. Other techniques can be used, such as tapping or sounds, but it really helps to reduce the feeling of and also the thoughts and the images of the trauma that the person might have done. Okay, so the other benefit is you can really focus on the anxiety itself in health anxiety. You can use EMDR just to focus on the anxiety, and it can help to reduce the actual feelings of anxiety in your body. It also can use past experiences, so traumatic past, how you feel in the present, your anxiety, and also future worries as well. So it's very good at doing that. It can also help with beliefs about anxiety. It can also process your thinking processes as well, and actually challenging and reducing negative beliefs about your health, and actually encouraging more positive beliefs. And it also encourages building positive resources. So practicing developing a sense of safety, a sense of confidence and resilience. And the last one, I think Hypochondria does is to actually help to integrate these into your daily life, to start to make sure that these practices are developed. So, for example, in EMDR, you develop a calm, relaxing place. So you imagine a calm, relaxing place, and that makes you feel really, really good, very positive. And you can do that on a daily basis. If you feel a bit of anxiety, you just go to your calm, relaxing place, and it really helps to make you feel calmer, but also creates a feeling of well-being as well. So there's my summary of all the different treatments available for health anxiety, and I hope some people find those skills useful.
Wendy, thank you for that. That's a really fascinating and a really detailed explanation of different options that are, or some of the different options that are available out there. So I guess what comes to mind is if people have listened to you talk today about this subject of health anxiety, and they're thinking that they recognize some of those symptoms. Maybe they recognize it in a friend or a loved one, and they're looking for that extra bit of professional help. What do they do? How do they go about reaching out for that?
So the best way of contacting me is going to my website, wendycastellino.com. And there's a way of contact me by phone or emailing me and just have a conversation, just have a chat, ask me how I can help them, or I can always direct them to other services if necessary. So yes, it's just reaching out and having a conversation. And what about you, Ian? How can people contact you?
Yeah, so Hope Therapy and Counselling Services have a website, www.hopefulminds.co.uk. We have lots and lots of free resources on there. We have lots of therapists, lots of counsellors who work with health anxiety. So people are very welcome to get in touch just for a conversation. And if we can help further, we're always very happy to do so. So really, just for me to thank you for today, Wendy. It's been an absolutely fascinating exploration of this subject of health anxiety. You've given a really good overview of what it's all about. So thank you very, very much for that. And I'm looking forward to doing the next one with you as well.
Thank you very much, Ian, for inviting me on. And thank you to all our listeners who have tuned in today. And I look forward to hearing from you again. So thank you to all our listeners and thank you, Ian. All the
Thank
best.
you.
Bye.
Bye bye.